Welcome everybody to the update today, 17th of April 2020, from the ANU Medical School. Just in case you're wondering what's behind me here, in these times it is important that we all keep our sanity and surround ourselves with those kind of things that we like. You know, I like soccer. So for those of you who are also a bit of soccer freaks and those of you who like to acquire new knowledge, I'd like you to tell me who this man behind me is, which country he's from, and then on, this picture, tell me where this game is held, who's playing, and who won the game. Please just email me and we'll give out a prize. There are some new appointments here in the medical school. Dr. Lee Stone, who's a GP and medical educator and had been up until recently the senior medical advisor for the Australian GP training, has been appointed as a senior academic in the Social Foundations Medicine area. And so has Nicola Palfrey. You might know her as a director of the Australian Child and Adolescent Trauma, Loss and Grief Network. She has been important in the development of the Emerging Minds Community Trauma Toolkit and is doing a lot of research around the bushfire crisis. Alexandra Curry has been appointed as a lead in pathology, helping out Jane Dahlstrom. On the professional side, Emma Hall is with us now. She's a private project officer for the MCHD review. Ming Lee is helping in clinical education. Ben Stewart is a project officer for the graduate workforce, and Fiona Quinlan has been appointed as the administrative support officer in the research area. Welcome all of you, and thanks for helping us. Dr. Diana Perryman held a research forum yesterday with the HDR students, and I think there were about 30 students or so online. And it was great to connect with all of them, whether they were sitting in the Northern Territory writing up their PhDs or whether they were just starting off and sitting here in the ACT. And I think it was really helpful for the students to not just hear from Diana, but also to hear from other students about how they're bridging the gap now that they have in not being able to do their research. Thank you, Diana, again. I think it was a great way to connect, support the HDR students, and thank you for inviting me. On the ANU campus, the thoughts around getting research back onto campus are ongoing at the moment at the ANU, CMIT, and around the research committees. As you know, ANU has stopped all research outside of that research that's COVID related, and that has affected a lot of the researchers, not just from a cost perspective for the project that they had and the funding that they had, but there was a personal cost to that as well. The colleges of science and health and medicine are probably very hard, maybe most hard hit, and there are plans now being made to return to research in a gradual fashion. Each college has been asked to develop some protocols and some risk management, and we've just started this conversation. We'll keep you up to date where that is going and when what is returning. The Year 1 and 2 students are continuing their research projects. The Year 1 students should know all the dates for their forms and their planning documents, and you should be securing your projects and your supervisors very, very soon. The Year 2 students, those of you who cannot complete their research project, you do have the option to submit a grant proposal, but please remember there's a process involved in that. You should have details via email from Professor Callahan. Otherwise, please contact our research professional staff. We have put more resources on the intranet around well-being, supports, exercise, some information for parents, and something around mindfulness, because we are worried about everybody's well-being. There's a lot of things that you can do yourself, and we just thought we'd provide some help and some links for that. You may be worried and wondering what's happening in the assessment arena. The first I've got to say is that we're not quite clear yet when the Year 3 and Year 4 exams will happen and how they will happen. We are considering the timings at the moment, particularly around OSCEs and long cases, if they even happen. In terms of online assessment, ANU is considering purchasing software that allows online exams, and we will just follow ANU's direction on that. The graduation timing is also topic of debate of the GOA at universities next week, and we will keep you up to date to see what they have decided. Clinical placements are still halted. There is no bedside teaching in phase 1, and I'm actually doubtful that that will return for this year. So that's not just been paused at the moment, that's stopped until you hear back from me. The phase 2 placements will not happen next week. What we are requiring you to do is to please complete your mandatory learning, and what the phase 2 professional staff have also done is they have pulled some of the teaching resources forward for you so that you can do some front-loading teaching before you go back onto your clinical placement. So I've been asked to be a bit clearer on what is actually happening behind the scenes, because all you seem to be hearing is that we're liaising and we're making a plan. So as you know, we paused clinical placements, and we did that at the beginning of the pandemic because there was just too much confusion amongst students and amongst clinicians about which students should be able to attend what placement. In order to have alignment across all placements, hospitals, general practices, health services, and to be very clear that the roles of the students needed to be changed and what the competencies were before students could go back to their placements, we agreed on a pause. And the pause was just to be for 3 weeks. 2 days after the pause, we received a letter from Canberra Health Services, a letter that all universities that have students at Canberra Health Services have, essentially excluding students for the time being from entering Canberra Health Services. So we're not the only schools or universities that do not have students at Canberra Health Services at the moment. And the concern from Canberra Health Services was really around safety for the students, safety for the clinicians, and safety for the patients. And the hospital also, this is Canberra Hospital, also needed to work a plan and involve a lot of clinicians in that planning to ensure that if there was a large number of COVID cases here in the ACT, that the health services would be prepared for that. They're doing a marvellous job with that. A lot of clinicians are helping out with that. And at the moment, it seems that students would be more of a hindrance than actually learning something. But we have developed a plan. We've developed a governance model. We have developed an idea of how students can come back in reduced numbers, probably an amendment of the duration of the placements. Students will possibly have to work in shifts or doing weekend work, and we have put some safety measures around that. That plan is with Canberra Health Services at the moment, and there's a meeting I've got with the CEO this afternoon, and hopefully we can clarify Canberra Health Services' position on that. But we have also tried to do a lot of liaison and a lot of communication and collaboration across the medical school and within the health services. So at ANU, I've always kept the Deputy Dean Education of the College of Sciences and College of Health and Medicine in the loop. The Deputy Vice Chancellor Academic is informed, and of course the Dean of the College of Health and Medicine, Professor Groen. Nick Taylor is the Associate Dean Phase 2, has worked with the Phase 2 committee since early March, actually February, has also met and emailed the block chairs and the curriculum leads, and we're discussing this topic twice a week in the Teaching and Learning TELT Education Group. Across health, the clinical directors, executive directors, and unit directors have all received letters with details on what we're planning to do and asking their feedback on what they think students can do and what students shouldn't be doing. I have spoken with the Chief Operating Officer, as I said, emailed and wrote a letter to the CEO and meeting with the CEO this afternoon. The Medical Director of COVID-19 in the ACT has been spoken to and is very supportive of students returning to their placements, as is the Director of Medical Services. Spoken to the General Manager at Calvary, and Dr. Carolyn Drosty, as the Sub-Dean at Calvary, is also working behind the scenes, and we're liaising regularly. And Professor Moore, our Associate Dean for the Royal Clinical School, is liaising with the New South Wales LHDs on clinical placements. But even nationally, clinical placements are hotly debated. Now, it's true that at the moment we are the only medical school that doesn't have any students doing clinical placements, but in other schools there's also a struggle. Most schools have final year students in clinical placements, but not the penultimate years, and this is debated by the medical deans. The medical deans have linked up with the AMC and with the medical board and published a letter strongly supporting clinical placements, because the ultimate year students now are the workforce for next year. And without these students, there will be no workforce in Australia, and Australia will have a big problem in medicine. But the Chief Medical Officer of the Australian government has also briefed on this. So I think it is fair to say that whilst it seems to you that the liaison isn't achieving anything, it is, and I think all efforts are being made to get you back. In the meantime, we just ask you to be patient. We know this is difficult. We know that you're away possibly from your families, or you're quarantining yourself at home. A lot of people are doing that. Use that time. Use the time to do some front loading. Use the time to be really knowledgeable about medicine and know as much as you can do now, so that when you go back, we will have the time for you to do your clinical placement, and you will be okay doing that in a safe manner. I will keep you updated on that, but please be patient with us. So there's some more information to be given out to the students. There's a Q&A next Tuesday at 3 o'clock. We'll send you the Zoom link. The Senior Faculty Executive Meeting also happens next Tuesday. Because we've reduced our number of meetings, because we're now in the COVID phase, business as usual, the staff emails have been reduced, as have the student emails that I sent. But please continue to ask your questions. Send me an email at the Operation Graduate email address, or shoot it to the Dean's email address. I hope you all have a lovely weekend. Get some rest if you can. Those of you who are working clinically, thank you for your contribution. Thank you for keeping the community safe, and I'll meet you next week. Thank you. Bye-bye.